1620 to order at 6:05 p.m. and I would like to go straight to public comment. We may have quite a few commenters, and we're going to try to keep to our practice of a half an hour of public comment. So I'm wondering if somebody makes the comment that you would have made when it's your turn to comment, you might say, I agree with such and such a person, so that we can get a sense of, make sure everybody gets heard. And so if you're interested in speaking, I think if you would raise your hand, then I can make a list of the order. So I see Amy and then Renee.
Jane, please remind everybody that we are not allowed to respond.
Oh, yes, this is not a discussion. This is a Al Thorpe, I see. This is, you're giving us an opinion, and then we can work with it as we go through our agenda, but there won't be any back and forth discussion. It's just the ways the legal system works here. So, and once we finish with the public comment period, I can't go back to you later. So I just want to make sure that you know that this is the time that to hear from you. Okay. And so far, I only see Amy, Renee, and Al. And okay, Alana. And so I'll be going in that order.
There's more coming in. There's more
Lisa
hands.
Warren.
Lisa Warren.
I got it. All right, I'd like to commence. And Amy, you have your 3 minutes.
Okay, the first comment is actually about the agenda. I really would like the school committee to consider putting public comments closer to when you discuss it or after, because having it before we're hearing what you're talking about is like me asking all of my students to ask questions at the beginning of their math class. And then when I give instruction, they're not allowed to speak. So I've asked several other school committee groups to please do this. It's hard for us to make intelligent comments when we really don't know what you're discussing, but I'm going to try about the vaccination for extracurricular activities. The pandemic has been very hard on kids. I'm a mom of a teenager. Sports has been a bright spot. It's a way for them to connect in person. My son is vaccinated, so please just know that up front. But I'm concerned that making a vaccination for extracurricular activities will limit our small school to possibly field complete teams in some sports in some areas. We already only have one girls team, not a JV and a varsity. If we even have 2 or 3 players, that could severely hinder us being able to be competitive and field a sport. And I don't feel that that's fair. Also, as far as I can tell, being a district employee, a parent, and a townsperson, our COVID numbers are not spreading due to extracurricular activities. That is not how they're being spread. They are not wiping out whole teams. I feel that this is overreaching. It also can't be put in immediately. You would need people to be able to make appointments, which are pretty hard to find sometimes. And if fully vaccinated is 2 weeks after their second shot, you're probably talking about a 3 or 4 week or possibly even 5-week turnaround, in which case winter sports are over. You're then talking about implementing something for sports to be outside in the spring, which I don't think need a vaccination. We're in a peak right now. I don't think we're going to stay here. I think putting a policy in place when we don't know where this pandemic is going is not fair. I'm concerned that we're having this discussion about what you want me to do as a parent with my child over a Zoom meeting when I taught all day and my son was in class all day, yet we're not meeting in person. So that for a lot of people that are logged onto this meeting is really hard to take when you're going to be making policies and demands on our children. When they're showing up in person, I'm showing up in person, but we're not having this meeting in person. If we were all vaccinated, if it's safe for me to teach all day, I don't know why it's not safe that this meeting can't happen in person. But so my feeling is it has nothing to do with my own child. I feel that it's overreaching on your part. It doesn't make sense going into spring sports. It's going to put an unfair burden to have a full team possibly, and it's not how COVID is spreading. So you're just going through hoops of making policies, but it's not actually making us safer. That's my comments.
Thank you, Amy. I'm going to recognize Renee.
Good evening, this is Renee.
Hope she muted.
You're muted, Renee. There you
Good
go.
evening. Well, let's try this. This is Renee Wood from Sheffield. I want to make it very clear that I'm speaking as a private citizen and not in any of my elected or appointed capacities. First of all, I really want to thank the committee and the subcommittee for tackling this "you can't win" issue. It's impossible. It cuts across political and personal beliefs, and it's a no-win situation. That said, I have two major comments. One, I think it's really important to understand the importance that extracurricular activities hold for most, if not all, students. Many of us probably when we were at this age group, and it was not as hard for us as it is now, valued the experiences, which have turned out to be wonderful life experiences and lessons given to us in a variety of extracurricular activities, including sports. I didn't have the mental challenges that I think so many of our young people and we ourselves face today when I was in high school. In fact, I've never had them. And I feel for our kids who are undergoing a period of education and craziness that we never could have envisioned. So I think it's really important to think about what extracurricular activities give our students, what they mean for their mental health, which I never thought I would discuss regarding students, and particularly for those who are aged 18 and under and do not have the legal authority to make the decision that this policy is asking them to make. To me, it's kind of like asking a second grader to make sure they get to school. Unless you're 18, as we all know, you cannot get a vaccination by yourself legally. And we have seen cases across the country where teachers have tried to assist well-meaning, but they've been arrested. So I don't believe this policy is going to have anything to do with changing a parent's opinion to get their child vaccinated. I think personally that's a wrong opinion, but the kid can't do anything about it. They can talk to their parent, and I would encourage them to, but in the bottom, at the end of the day, it's the parent who makes the decision. Yet this policy to me holds the child accountable who cannot legally make that decision and penalizes them as such. So unless you can figure out a way to hold the parent accountable, and then you're into the whole political nonsense that goes on about individual rights, I think this is an exceptionally well-meaning but not effective policy that will penalize our children, not do well for their mental health in many cases, pit potentially child against parent. And we already know that a number of our children in school struggle with their parents as it is. So I would urge you, in spite of the well-meaningness of this, I would urge you to veto this policy. Thank you.
Thank you, Renee. And Al Thorpe.
Hi, thanks, folks. I'm here this evening because I heard that the committee was going to be discussing a potential policy which would limit or prevent unvaccinated students from participating in in extracurricular sports. I've seen no written articulation of that policy, and so I'd have to concur with Amy's suggestion that the public comment for such a discussion of a matter should be included with the presentation of that matter in particular. I think it's almost absurd to solicit input from a public which has not seen what is being discussed. And I did, for the record, look at the minutes of the school committee, and I could find no articulation of it. The minutes are many months back in terms of being put online. So I don't technically even know what is being proposed. And so my ability to make specific comments upon the proposal is severely limited. Nonetheless, I would go with what I've heard, and that is that the committee is considering this policy. I think it's a terrible idea. I think the idea of limiting children from extracurricular activities, in particular sports, is likely to do more harm than good. I know that sports in my own children's lives are one of the highlights of their experience at school, and the idea that that would be taken away from them through this policy, I think is punitive in nature. It's the number of cases is widespread, and but my understanding is that what we're going through right now is a variant that with very mild symptoms, and I'm against the idea. That's all I have.
Thank you very much, Al. Alana?
Thank you. Thank you to the school board and the administrators and everyone else on this call. I do just want to start before I talk about what I am going to talk about, that after school activities in themselves are inequitable in our school. I work with a population of people who cannot go to after school activities because they don't have transportation home, because their parents thrive, or for other reasons. And so, you know, I agree. I think extracurricular activities are extremely important, but let's not just use this as you know, if we really want to start to focus on mental health and extracurriculars and all of those things, let's not forget about the people who never can join because of systems we have in place that already exist, and that nobody is really stepping up to change within our community. But I'm really here today to just urge two things. The first is, you know, I believe we need to do everything we can to stop COVID. I'm a healthcare worker. I've seen what it does. Even this mild variant is filling up our hospitals. It's decreasing our workforce, and this is a public health issue. So what this means is vaccine mandates, better masks, and stricter in-school guidelines. So today I ask that the school lead as an example and go above and beyond the minimum standards that DESE has set. I am asking for a few things. The first is that I'm asking the school board to ask the administration that when kids return on day 6 of their illness, that they are required to wear a KN95 mask or a surgical mask with a surgical mask and a cloth mask on top of that. Second, I would also ask that these children are eating in a separate room. I don't think there's anybody on this call who would eat within 6 feet of someone who has COVID. The CDC guidelines are clear that say nobody should have their mask off if they're still within the infectious 10 days. And for our children to be forced to eat next to a child who they know has COVID is creating a higher level of mental stress for our children and our families. And I think this needs to be addressed extremely quickly. And I ask that it be addressed tonight with the request to the administration. This is being done at nearby schools. They're normalizing COVID in a way that's making it less scary. They're making it okay that kids need to sit with the principal for lunch or do something else. The second thing is mental health. It's clear we have a mental health crisis from COVID. Dr. Regal Budo talks about this often. Parents are talking about this. We're hearing it all over the place. I have not actually seen interventions this year with the children in school or with the families. So I would ask that the school board work with the administration to look at the COVID funding sent by the state and future funding that will be sent by the state to offset the impact of COVID, and to look at the upcoming budget and present a well-articulated plan with clear action steps and a timeline addressing how our district is going to begin to address this issue in our school and with our families. Thank you.
Thank you, Alana. And finally, Lisa.
Hi, everybody. I know this is a really difficult time for everybody, regardless of how you feel about this matter. And I just want to say that I agree with a lot of the things, everything that Amy, Renee, and Al spoke about. I have students in the school, and I think regardless of how you feel, what your beliefs are on this matter, I think we can all agree the mental health is an issue. Extracurricular activities and sports clubs and teams, we don't have a lot of participation. Maybe it's because of what Alana was speaking about. That could possibly be, by all means. But I think it's harmful to our students to put this policy into place and take some of this away from certain students. I think that it's in certain cases, it's a punishment on the student based on the parent's decision, which is punitive and unfair to the student. I think sports and extracurricular activities are a bright spot in a very difficult time. And I don't believe that in the hands of family vision for a small community. And that's really all I really want to say, but thank you all for considering this matter.
Thank you, Lisa.
Jane, Jessie Lane, I think also wanted to speak.
Oh, did I miss her hand in the beginning?
She wrote it in the chat.
Okay, I'm sorry. Jesse?
Hey there, I just wanted to say that I agree with Amy and Lisa's perspective on all of it. Thank you for your time.
Thank you very much. All right, I thank you for showing up. Sharing your views, and we will be remembering what you said when we get to our consideration of a possible mandate for vaccines for after-school activities. There's a couple of other things on the agenda here that I think everybody will benefit from hearing. We have a update of the status of our situation in COVID from Dr. Regubuto, followed with a report that we requested from her on our December 16th meeting about what options we have for protecting kids who are in after-school sports. And then later on in the meeting, we're going to hear from the policy subcommittee. And then there are a couple of other subcommittee reports that don't have anything to do with COVID. So I think it's going to be an interesting meeting, and I understand you have lots of things to do. So we welcome you to stay, but we understand if you can't. All right, so I'm going to be turning the meeting over. We're on item 4, new business, district and community status on COVID-19.
So I'm assuming that I'm not sure if you want me to do, really the only thing that I was going to talk about there, and it kind of all ties in also with the district's response to the school committee motion, but the status is what everybody expects. We've been working very hard, and we know that there's an uptick. Clearly that's happening, and we're still posting a chart on a daily basis, and I'm going to own it because I've been working 23 hours a day like everybody else trying to make things happen, and we've had a lot of weather incidents, and we've had some other issues that have been going on. So after I finish tonight's meeting, I will be updating the chart for the last 2 days. But other than that, I've been keeping a chart that is updated with the number of cases and cumulative for the week. The reason we do it that way is because they're coming in literally as I'm sitting here, I get another notification. So in order to not send 100 emails a day and to try to keep it in an efficient way and keep people updated, we're putting it in the chart as you see. The numbers have been headed up for sure. As we know, the mask mandate from the state was extended, doesn't apply to us because we're already continuing the mask mandate in the district. Meaning that we're already doing that, and it won't change until the school committee decides that we won't need them. Let me think. As far as everything else, our protocols and our practices are the same. We're still working on pooled testing on Wednesdays. We're still helping to bring everybody as much information we can on vaccination clinics, on where there's pop-up test sites, on making people aware of when they can come back, what they need to do, trying to support everybody in every way possible. And there are so many people to thank, and so many people who are just, as you know, everywhere, extraordinary in stepping up when we need them, because this doesn't end at the end of the school day, right? Reports are coming in at 11 o'clock at night, at 4 o'clock in the morning. So they're all weekend long. You know, people were, through most of the holiday, people were working with the state. So there's a lot going on, and I just want to acknowledge and thank everybody. We had an issue yesterday, and there's people all over the community that we can reach out to and are answering us and helping out. So I really appreciate that, and I know the entire administration does. I'm in a group chat with the Berkshire County superintendents, and there's about 70 people on that chat, and they were just talking about what this feels like. And I think it doesn't feel any different for anybody at home who's dealing with it. It feels incredibly challenging to manage in a way that makes everybody feel good and safe, but we're doing our very best. You know, that people are nonstop caring about kids, and that's our first priority. So I just wanted to let you know that. I will go into the other response after, if anybody on the committee has a specific question they'd like to ask.
Any committee members have specific questions they would like to ask Beth?
I put a link to the latest chart out, but like I said, I have to update for yesterday or today because I just haven't had a chance.
Mm-hmm.
Beth, just can you summarize for us what we should be getting from the state in terms of support that is or is not happening currently, that there's a gap of anything? Yeah, is there any gap in anything that we're expecting from the state that's not happening currently?
Well, I mean, I think the reality is, like, for instance, you know, superintendent spent New Year's Eve waiting for information on the testing kits for staff. And they said they were going to hand out 400,000. And when it came down to it, they handed out 277,000. So our district got 174, which is less than the number of staff we actually have. So, you know, there's what's out in the public. I think what's really interesting is there's sometimes a lot of misinformation out in the public, and you know, we're all hands on deck, so we don't really have time to go out there and correct everything. But I want people to know sometimes we have to make adjustments and deal with what we have and try to prioritize who needs those tests and, you know, those types of things. Same with the mask. There's a whole big mask thing. If you really want to read something for fun about the KN95s and the, you know, who's on first, which one's the right one, the wrong one, who should have them, who shouldn't have them, you know, there's a lot of information, and we are digesting and getting lots of advice from a lot of different sources, and a lot of times it's not accurate, or what's being perceived as what people are doing is not accurate. I can't spend all day. Our big focus is, what are we doing to make sure kids are safe every single day? And it's not that I'm turning around and disputing every little thing out there. So I just want people to know that sometimes it's not everything that you hear. Sometimes we didn't get everything that they said we got. But right now, I would say, and I can let Sandy chime in from Health Services, we are well staffed and supported for our pooled testing efforts. And you'll see that in our in my response to the school committee's motion, that if we were to add people to the pool for extracurricular activities, that we could support that and be able to test and ensure safety across the board. So I don't think there's anything. Sandy, would you say that we're missing anything from?
No, I think the important to say that we're well staffed on Wednesdays.
Well,
because
that's when we do pool testing. You're right.
We have three people who have been coming in to help us. We have a new program coordinator. There's been some changes in staff. The program coordinator is now coming on Mondays to help us prepare the pools. So we're really fortunate in that, but their day is Wednesday. And so that's where we have the staffing.
Beth, Beth.
Dennis, wait a minute. Carrie Ann had her hand up, and then Bonnie, and then you, okay?
Okay.
Carrie Ann?
Thank you. So, I mean, in my short tenure so far being on the school committee, COVID has been front and center in almost every single conversation that we've had that so far in every meeting. And what I am understanding is that COVID's not going to go away. It is part of our new reality, and I think most people at this point, it feels like a bit of a nightmare that we are living through as we get into the long haul situation that we're dealing with. And so, as you know, I've now been checking the numbers that you've been, putting up, Beth, daily, sometimes multiple times a day as I watch them change. And it feels like we are being asked to put out a wildfire with a mason jar. And I really am wondering when we as the school committee are going to make a stand and say that this is enough, that these are like, we are not accepting the amount of children and staff who are getting sick. And I understand, and you all have heard me say this before, that the state has tied our hands and will not allow us to use remote learning, and that we have decided that remote learning is not a good option. Even though we made that decision when we created a remote learning system during a pandemic in an emergency moment, and that we have not had the opportunity to fix it. So I'm wondering, it seems like the only option that we have is to start taking vacation days, snow days, to close our schools, to not do remote learning, and to change our calendar. And I'm wondering when we as a school committee are going to start talking about closing our schools so this way we can keep our community safe. Thank you. So I can only tell you this. The commissioner has made it clear that remote learning days, as you know, I'm just reiterating, just so people don't think this is, something I'm just saying for fun, will not be counted. So we don't want to waste that, right? That opportunity. With that said, in the areas that unless you have specific permission, and we all know how that goes from last year, but if you have specific permission, and I would say really hard to get unless your numbers are every single person in the school. And even though our numbers seem large, for us, they're not at the levels where people would be saying, shut a building. And you can see we were able to do that, or I should say a program, because the class was not really a school eligible grade level of where they count it. So you can do those things with those grades, let's say that. But the commissioner has said that you are, in those events where we feel like we really need to shut down, we are to use our 5 snow days that we would have to make up, that he said, you can use those. And then he's going to see how many of us have to do that, and maybe there will be some type of relief. That's all I can tell you. That's all that I've heard to date on that topic. That's the latest that I've heard on that, just if that helps at all.
Bonnie?
Okay, thank you. The question I have, sorry, could you just, maybe this goes to Sandy, explain how pool testing is currently working?
Sure. So pool testing, anybody who is signed up, we prepare the pools
Okay,
now.
just
on
one
Monday.
second, that it still stands that they must opt in, correct?
Correct.
Okay, thank you.
Not an opt-out, it's an opt-in. And currently what we're doing is we're preparing the pools on Monday, and recently the state gave us guidance that we should decrease the number of people that we're testing in each pool in an effort to hopefully minimize the number of rapid antigen tests we have to do for follow-up. So we've increased the number of pools we're doing. We continue to conduct the pool testing on Wednesdays, which is when we get support from the state agency, which is right now Healthcare IT is the company.
How many groups are there, and how many kids in a pool?
Okay, so I looked at the elementary today. Again, this just changed this week. I believe we have 23 pools At the elementary, it used to be, I think it was 16. I think we're at 23 now. And the maximum number we have in the elementary pools is 5. At the secondary level, there is a higher number. Total number of pools prior to this change was 32, but I think we're more around, it's closer to 40 or maybe 42 now total.
Okay, given that,
Mhm.
if a pool comes back positive, since contact tracing does still exist for schools, how do you proceed with a positive pool?
We proceed with following up with rapid antigen tests for all the people that are in the pool so that we can try to determine and nail down where the positive is. And then we proceed contacting families, there's a variety of protocols. If anybody's seen them, they changed recently again on December 30th. But we follow the protocols in accordance to whatever the status is, vaccinated or not vaccinated. And then we also contact close contacts and make decisions there based on the close contact protocols. So there's many steps that are involved, once that happens.
Thank you very much.
You're welcome.
Dennis?
Yes, I had a question. I had a follow-up question for Sandy. If are you still there?
I am.
Okay. On the whole area of pooling,
Yes.
we know who's in each pool, right? So we know who it is that you actually then
Yes.
have to do a quick test on, right?
Yes, we maintain sheets, so we know who's in each pool. Yes.
Okay, so that I think that's one of the great things about pool testing is that it's another lever. Now, the only thing I would ask is that is that something that can be, quote, mandated? In other words, if I'm a student, do I have a choice of whether to be in the pool or not?
The parents opt the children in, and they complete a consent form if they want their child to be in the pool testing.
Okay, thank you.
You're welcome.
All right, looking for any other members' hands up. Dennis, would you take yours down so I know that you're not asking another question, and feel free to ask another question whenever you want.
Thank you.
Okay, so Danelle's hand is up.
Hello, can you hear me?
Yes.
Okay. So just a quick question on, let me see if I can get my video. Okay. One thing that Alana brought up was the masking after a COVID positive student returns back to school and the lunch. I know in some classrooms it is being implemented. Do we know if that's district-wide? If they can be brought to a different room or with the teachers to, while their masks are off, to be eating somewhere else, and then also the implementation of the KN95s for when they return for the following 5 days of the 10-day quarantine.
So I'm just going to be honest about it. We have guidance and we have worked with the state. The state has advised us that they do not feel that it is appropriate to segregate children based on the fact that they've had COVID. And they were very clear about that. We're going to still follow all the protocols that we're following. We're still going to do the distance as much as we can do where we can do it. I understand that people are doing different things. I don't think all of us necessarily feel that some of those things are appropriate, and that's up to whomever. But we have done the same thing that we've done all along, which is listen to the guidance and be as diligent as we can. What I will say is it is not protocol or the recommended guidelines per the state or the CDC to us that they require an N95 from or a second mask. However, with that said, we have ordered them and they are available. If people want to wear them from 6 to 10, day 10, we have made them available and handed them out at every cause, you know. I believe even our principals met with the children again to go over the appropriate way to wear masks, to make sure that they're wearing them. They've had, you know, we keep going over the importance of safety and following all the protocols during this time. So that's where we are.
All right. You had another question, Carrie Ann?
Well, it seems like, you know, the state does the bare minimum, and that we have the opportunity to potentially put in more stringent rules in place for what we're doing. And if we are a district that is surrounded by other districts that are successfully putting in place measures that aren't necessarily, like, we're not looking to segregate children who have had COVID. We're looking to keep separate children who are still in the contagious period, just from day 6 to day 10. That's different than saying children who have had COVID. Those are two different populations. And so we have the opportunity as a school committee to put that in place, correct?
I'm following the guidance from the state, and I am saying that, you know, we also have to manage a school district, and I'm not sure how we are going to, and when I say segregate, I mean you are taking a child in other districts. My understanding, again, I don't usually manage what I'm doing based on what other people are doing. My understanding is in the one program that was referenced that they are taking the children out and putting them in a separate room and making it a fun experience. Whatever, that's fine. But you are removing them from the normal experience. And so there's that. The second piece is knowing with the numbers of children that we have, who's coming back on day 6, on day 7, on day 8, to make sure that everybody has 2 masks on, where they're sitting. It's a lot on the management of a district, and I just want to be doing things that we know we actually can do and what we're asking our faculty and staff to do on a regular basis. So, you know, I think we can do our very best, and that's what I would say we would do if that's what the school committee feels like they want to mandate.
Could I say something real quick, please?
Sandy, of course.
You know, I've been in this role, right? This health services director role, which again, I'm not a doctor, I just play one during the school day, but I've listened a lot, and I've talked to a lot of people, and I talked to the public health nurses, and I go to all of the meetings, and, you know, I on various listservs, and I go down and plead my case to Beth and the other members of the administrative team. And, you know, I took this very seriously when we had conversations about the KN95 mask, you know, for making those available for children who are returning after COVID and in the 6 to 10 day window there. Talked about the double masking. It was something that I discussed with Amy Hart. And, you know, I made that recommendation, not a mandate, but a recommendation. It's something we could definitely make sure people are aware of as a mitigating strategy. You know, we're thinking about lunch. I get very concerned about that. And, you know, the recommendation is that children wear their mask at all times when they're not actively eating. And that's something that I did share and recommend, that, you know, we can maintain the distance and we make sure that they're keeping their mask on. And it is a hard management issue. But what I'm concerned about is we had 15 students last week that tested positive, and not all of them were in school. So we're talking about in our school, maybe currently, I'm just talking about last week, maybe 7 or 8 kids that we might have been discussing at various grade levels and ages. And so in many of these situations, we're talking about one kid eating alone. So those are the things that I get worried about, is the isolation. We have to be safe. I completely agree. But, you know, there's just so much to consider in all of this, because it is, you are kind of making information available about kids if you're doing some of these strategies, and just trying to find the balance being in a public school like we are and trying to do all the right things. So I just needed to say that because we haven't taken any of this lightly. You know, we've had some pretty serious conversations over the past few days, and I think everybody that's on the administrative team would tell you that. So anyway, thank you.
All right, we ready to go on to unfinished business, the update of the request that the school committee made of Beth at our December 16th meeting. And for those people who were not present at that meeting, I'm going to read the request for you so that you know what she's responding to.
That's why my hand was up.
Yeah, I have the motion. Would you rather read the motion than, or should I?
Oh, I was going to read the motion.
Well, go ahead,
But if
Bonnie.
you,
No.
okay. Motion, which was passed either 8-1 or 9-1. I don't remember if we had a full committee. Motion, vaccinations are one of our most effective tools to reduce the spread of COVID-19. With the best interest of our students, staff, families of our greater community in mind. The school committee of the Southern Berkshire Regional School District establishes the following guidelines in order to maximize opportunities for safe in-person learning. 1, all eligible district students should obtain the full vaccination regimen as appropriate for their age against COVID-19. Medical, religious, and special needs exemptions can only be granted by the superintendent based on provided documentation and consultation with the medical community. Failure to obtain full vaccination will not, at this time, result in exclusion from school. Upon approval of this motion, the chair will forward a copy of this motion to the boards of health of the 5 towns, DESE, our state, local, and national elected representatives, in the hope that they will quickly establish necessary guidelines to assist the school committee as it establishes policy in keeping with this motion. Great hope for that. That was not in the motion. 3, further, the school committee directs the superintendent, working with her administrative team, our nurses, and the district's doctor, as well as our public health team, to provide the school committee 48 hours prior to our next full school committee meeting, January 13th, with a plan for pool testing for all students, vaccinated or not, involved in any extracurricular activities, as well as additional safety precautions and vaccination options for these students. This plan should include a suggested schedule, the need for additional personnel, including community volunteers, and costs associated with implementing this plan. 4, finally, the superintendent shall share this motion with other Berkshire County superintendents and other administrators beyond the Berkshires as she deems appropriate, in the hope that this motion will initiate a county-wide plan for protecting our students. It is the hope of the school committee of the Southern Berkshire Regional School District that this motion both conveys our belief that full vaccination, including boosters, is the best way to slow down the spread of COVID, and our desire to decrease already heavily polarizing commentary. Clearly, we all have the best interest of our children at heart. That was the motion that was passed at our last meeting. It's not a policy. It was a motion that Beth then handled as she's now going to report.
Thank you, Bonnie.
You're welcome.
Are you ready?
We are ready. We're very excited.
Well, don't get too excited. So I will post the document. I gave a response to the school committee as requested. So I sent that all to the school committee, but because we're discussing my response in public, I will post my formal report that I gave to the school committee onto the website tomorrow with the packet, the documentation from the packet. which was really only a couple of things. The first part of this, I kind of responded to the number one portion of the motion that Ms. Silvers read by talking about our goal, just like we've been talking about, of striving to maintain the safest educational, safe learning environment for everyone, still employing all of our strategies that mitigate potential exposure, and to support any school committee motion that all age eligible district students are encouraged to be vaccinated against COVID-19. This is the administrative recommendation in response. Upon adoption of any policy, we recommend that those students age ineligible or who have been granted an exemption for medical or religious reasons should be required to participate in the district's routine COVID-19 testing protocol. So in number one, I won't go over it again because we just talked about it, but I shared with a link to the chart, how the chart works and how I report, because I have gotten lots of questions and that I've been answering about why did I pick Wednesdays, or why does the chart go Thursday to Wednesday? And it's just so that it keeps us all in line with our actual reporting requirements to the state. So that's when our week changes. So I thought it would be a good place to put this so people can understand. I didn't randomly pick those days on my own, because who would? The district meets regularly with our public health team to get updates, insight, advice, and support with our decision-making, operational information, implementation protocols, and best practices. Our health services team and administration consults with state advisors. We follow the CDC and guidance that's regularly provided. We're working with our local public health partners, and the district shares any information on upcoming vaccination clinics and or testing options that become available. In here, I've included our public health partners had shared with us the upcoming clinics at Fairview, so I've listed all of those. And Sandy, I'm not stealing your thunder, but I also included that we're having our own vaccination clinic at the district on the Sheffield campus on January 27th, 2022 from 1:30 to 4 p.m. And I put the link in this document. Sandy will report on it. And I believe we've sent out information via the app and on the website about our vaccination clinic. I also asked the health services team, because I have a lot of free time, to see if they could help us get some other key vaccination data, so we could at least get a sense as a school community where we are right now. So what we've been able to gather at this point is at Undermountain in the 5th grade, we're 42% vaccinated. At the 4th grade level, we're 34% vaccinated. And at the 3rd grade level, we're 55% vaccinated. At the Mount Everett, grades 6 through 12, we are 78% vaccinated. We have had an offer from one of our public health teammates in Egremont, who has been working to help us get even more information on the younger age groups. And Sandy, we've reached out and we're connecting. We've given information, but as you know, everybody is pretty tied up. So we're waiting to have them help us when they get a chance. So that's under part 1. Do you want me to? Did you have a question, Carrie Ann, on what I didn't know. I thought I saw your hand go up. Okay, sorry. I don't know. I thought I saw a hand. So under 2 on the motion, it was requested that we send information. So the chair worked with my assistant and we forwarded a copy of the motion to the boards of health of the 5 towns, DESE, our state and local and nationally elected representatives immediately following the December 16th meeting. Currently, I personally am not aware of any responses, and I don't know if anybody else is. I'm not seeing any. Jane has not received anything. Okay. Director Hubbard for number 3, Director Hubbard and the health services team confirmed that in partnership with our program director from Healthcare IT, that we could include those students who participate in extracurricular activities and who are unvaccinated, age ineligible, or who have been granted an exemption in the weekly pooled testing groups. At this time, the health services team feels that they have enough staffing or supports in place to manage that increased participation. Other staff members have been trained as well to assist when and if needed. If there does become a need for additional volunteers, the health services team will reach out to our community. To be a volunteer, one would need to be 18 years of age, be willing to be trained in administration of routine COVID-19 pool testing, give a commitment of up to 4 hours each Wednesday morning, and must complete and pass a Corey fingerprinting, meet the Corey or fingerprinting requirements. And in number 4, I am on the docket tomorrow morning with the Berkshire County Superintendent's Roundtable and scheduled to present and engage in a discussion of potential county-wide solutions tomorrow morning at 8 a.m. with that group. So we've had lots of discussions about would it be helpful if we put all of our voices together to get some guidance or get some action at the state level about nailing down how to handle some of these things in a more timely manner. So that is my response, and I will post that.
Jeff, I see your hand up. Thank you very much, Beth.
Thank you, Beth. With regards to our scheduled clinic at the school on the 27th, how many registrants do we have?
Well, we're just releasing the information, so I'm not sure who's Sandy, have you looked? Can we see how many?
I don't even get access to that. It's the Behavioral Health Network maintains it, but they're hoping to vaccinate approximately 175 people that day. Flu shots and boosters will be available.
And initial courses or second courses based on what it is,
correct.
But it needs to be reserved. Okay. And how many? 120?
175.
175.
Do we know if students from the other campuses are being marketed and know about this as an opportunity as well?
Yes,
for vaccinations?
district-wide, we've been marketing it.
Okay. Thank you.
Any other questions?
Another question.
Okay.
Regarding that clinic, kids from the other campuses, will they be able to get transportation, like on a marshmallow bus or something like that for the vaccination if approval is from the families?
We hadn't thought about that because usually people sign up and bring them for when they I mean, I guess we could see what kind of, I don't know how that would work because you'd have to bring a young student over, and it would be with maybe a family member while they're, I don't know.
Yeah, I'm raising my hand here about, is it possible for a parent to sign a release for a vaccination, or the parent has to be there for it?
They can sign a release.
There's a form that's listed all over the place, and it gives someone under 18 the ability to go without a parent or guardian as long as that form is filled out and they bring it with them.
Okay, great. Thanks. All right. And no more questions about this presentation? Seeing none.
Jeff's hands back up.
Oh, sorry.
Sorry,
It's okay. I'm trying to
my
watch
mouse
that.
is slow moving. I need to change the battery on it.
That's fine.
Regarding the roundtable, has there been any dialogue prior to tomorrow's meeting that you're going to, that there's already conversations that are germinating around with the other superintendents?
Oh, it's constant.
What?
They're constant conversations about, strategies around, decision-making around, for instance, we had an issue the other day because of weather, and part of the protocols in the state is that you have to have the bus windows open, so when you have -25 degree weather, we're not going to put kids on buses, even though we probably could have made the buses run. You have to think about, what does that mean longer term? We have lots of days that are single digits or below zero. And, so superintendents are all over the place, having conversations about trying to make good, solid safety decisions. What are you doing here? What are we doing there? What could we do better? And I think the consensus is around, will it help? We actually reached out to the commissioner and said, what does it mean when you say, weather permitting, we could close the bus windows? And the response from the commissioner was every other window. Well, I don't think any of us were willing to take that risk if something happens and they're an hour away from home, sitting on the side of the road and they're cold. There's just, I think it's hard. And I think we're doing our best to put together concerns and to ask for definitive answers ahead of time about best practices, about things that we can do to improve the quality as we work through this. So that's kind of, but they're ongoing all the time, just so you know.
But specific to COVID-19 policy or strategy, it's like
right.
that, what are the themes that are already currently being discussed that have happened prior to tomorrow's meeting?
I think it's more about how everybody is just so thinly stretched, and how recognizing that's really what it is. Mostly people are saying, I mean, I really don't like to share some of them, but sometimes people say they feel like they're, organizing the chairs on the Titanic. I mean, there's no good answers. I think superintendents feel very, and I think administrators in general feel very overwhelmed and very stressed, and people are tired and people are sick and they're sick of this. And, those are the basic conversations, and we're feeling bad for our staff, and we're feeling about, trying and all, but our main focus is, how do we keep kids in school safely? Because we know that keeping kids in school is where is really best for them, and how to make sure that is safe and it outweighs anything else. And it's a hard balancing act. And I think that's just being realistic. And those are the conversations. I don't think anybody's said anything about policy. I think the discussion tomorrow will be around, do we want to ask the state to say this is going to be a required vaccination? Like, I think people don't really love the idea of it being here and creating divisive environments in individual school districts. They'd like to see someone take a stance. I think those are the kinds of things we want to talk about.
I saw your hand, James.
Yeah, you did. Been a licensed psychologist for 40 years, and I'm feeling depressed. Child psychologist. I guess I've been doing some reading, and interestingly enough, before COVID, the WHO listed vaccine hesitancy as one of the 10 biggest global health problems. This is historically a problem, and we're historically in the eye of a perfect storm here, because COVID, for many reasons, kind of ups the ante on all of that. The autism people who thought that measles vaccine would give their kids autism, and that sort of thing has always been around. But this is such a more virulent kind of thing. Interestingly enough, in many places, adolescents can seek medical care without parental consent for things like contraceptive or abortion services, treatment for substance abuse, mental health disorders, STIs, and the New England Journal of Medicine, there was an article saying that adolescents from 14 up are about as good as adults at making medical decisions. Okay, so I think one of the things, and I just was responding, I think I started this responding to Beth, yeah, the kids need to be in school. They need to be somewhere where they can be doing what kids are supposed to be doing. It's a big risk, obviously, because of the how easy it is to get this virus. But the main things that people are finding, and this is again from New England Journal of Medicine, is kids are coming in, talking about loss of social connection, no longer feeling safe in their daily routines, questioning whether they're safe. You know, we're saying, well, you're safe in school. Well, maybe you're not. Well, maybe you're not safe at home. Maybe you're not safe, you know, playing sports. Okay. Losing trust in systems and what's called anticipatory grief. People start grieving about the losses that could come in the future. I think that in addition to the pool testing, which is a wonderful thing, I think that being aware that we're going to have kids coming in, particularly adolescents who may think they have a better take on whether they should have the vaccine or not, you know, not just because they want to play extracurricular activities, but just because they can also, you know, listen to the news and hear what we hear on TV and all of that. That we've got kids coming in already on the edge of, you know, some sort of mental health issues. And now are they in opposition to their families? Are they more frightened because their families are frightened? The main reason historically that parents have been resistant to immunizations, going back to polio, going back to the 50s, was fear. It was kind of unfounded fear. So, you know, I mean, so there's no reason why parents wouldn't be fearful now. Okay, so I think that if parents are fearful, children who are fearful, yeah, that having that routine, having people who are trying to take care of them is a wonderful thing. I think that the staff in our schools are heroes. And I don't know what we should do about extracurricular activities. I don't think we should allow children to be exposed any more than they have to be. You know, we're doing the pool testing and we're doing all that we can. Do we know what other schools are doing? And even if they're doing it, you know, Mount Everett is 78% vaccinated. That means 22% of our kids versus 22% of the kids from Berkshire Hills are not vaccinated. I don't know if they're all on the basketball team, but I think that there's no easy answer here, but I think the mental health toll on all of this, and this is not counting the mental health toll on our staff, who have to face these kids and then go home to their own families, okay, is something that we can't discount. I think we have to keep open to that. We have to have the kids, as well as getting the pool testing, have the opportunity to somehow talk to somebody about whatever the crisis is as they see it. That's all I think that's enough. I don't want to.
Yeah, thanks, Jim. I see Dennis's hand up.
Yes, I'm going to take the opportunity to give you all a little bit of a history lesson, okay? Since we are school committee members, I think that's appropriate. And it's appropriate with the subject that we're talking about. This is the third time in the history of the United States of America that anything like this has happened, what we're going through with COVID-19. Basically, it happened in the early days of the revolution under George Washington. And basically where George Washington had to, in effect, forcibly vaccinate his troops, okay? The same thing happened in, like, I don't know, when was the big flu epidemic? About 1910, 1912, something in that area?
1918.
18 to 20.
Yeah, the same thing happened. Here comes this deadly thing that's killing everybody, and they had a vaccine, and they did forced vaccinations. One of the things that we have, which has been discussed tonight, that I think could be a lifesaver compared to, being in these other two times in the history of our country when we've been in such a desperate, health problem, is that we now have pooling, and pool testing, and it's an admirable piece of work that the administrative staff has done with all that they have done during this period of time. And I think we need to all kind of make sure we give them that credit, that they're due on that. But I think one of the things that we have going for us right now is pool testing. And it sounds like the administration, to me, has been doing just an outstanding job of making us, as a district, probably one of the leaders around in the use of that as a tool to, to help the survival and so forth. That's about as much as I'd like to just make that comment on that, we are in a different place. But I think historically, a lot of people don't even remember that this is now the third time in the history of our country that we've had this horrible of a situation from a health standpoint that we're in right now. Thank you.
Okay, Bonnie.
Thank you. First, with everything going on, I really do have to extend a major thank you to Beth, Sandy, the entire administrative team, our principals for putting together this report and giving us some real guidance, and including the fact that Beth has figured out with her team a way for students to have an extra pool testing if they're involved in extracurriculars. And I know we've been concentrating on the whole issue of sports, but remember how much more extracurriculars mean for so many kids. And I'd like to go back to something that Renee said, which is how much I know for me, all my extracurricular activities, so this is personalized, were so critical. And I've sat and watched kids in robotics, and it becomes like a therapy session in addition to what they're learning, because having adult mentors around, they wind up saying things that they haven't said to other people. And I think we really have to take into consideration as we move forward. I really appreciate all that you did to respond to our motion. And I'm going to go back to the main thing that Renee said. We have to be careful in what we do to not blame the children for what they do not have control over. And I have been speaking out in my community to parents on a wide spectrum of political views and students. And students have been telling me that they have friends on campus who would love to be vaccinated, but their parents will not let them. Are we going to force them to take on a fight that they really shouldn't be engaged in? So I think as we move ahead, we have to look at the place that we are, and we have to really consider in so many ways. I mean, obviously for my life, there's never been anything like this. When the polio vaccine came out, Us, little kids were marched down to the cafeteria and, didn't matter, we were 5 or whatever, and they gave it to us. It was not a question. It became salvation. So we have an incredible responsibility as a school committee, but we have a responsibility for the whole child. And Beth, again, thank you to your team. Please extend it.
Will
Those
do.
things.
If I could just say one little thing, Jane, just in response to Jim and lots of people, Carrie Ann mentioned it the other day, we were talking about it. We're astutely aware of the amount, or acutely, I should say, acutely aware of the everyone's mental health status, hence why I was using a different word. But I think we have this year had invested in more mental health professionals working with us in the district. We've created additional programs. Sandy and Julie and we've been writing grants like it's our 75th job. Sandy just got another one today that I think huge dollar amounts to support the mental health needs of all in the school district, and we'll report on that in a much, maybe next week or greater terms about the kinds of supports. But we're very, very conscious of this, and we talk about it with our social emotional health, and we'll share more as that comes out. But we're very, very conscious of it, and we know that kids need it, and we want to be there for kids and faculty and staff. We all need it. So just know that we're on that, and we're very concerned, and we want to be there to support each other and the kids.
All right, we completed the unfinished.
I just put my hands up again. I'm sorry.
Bonnie, okay, but we've got other stuff to
Real
do.
fast. I am putting him on the spot, and I don't know if he can respond, feels comfortable responding. Jesse, you've been our athletic director for years. You're our principal. You've taught in our classes, and you have 4 children who've either gone through our district or are going through our district. What is the sense as our middle high school leader that you have of the situation, and any recommendations for us, if you're willing?
I'm happy to speak about it. As many people have said before, I really think it's a mistake for us to take away extracurriculars from kids, considering what they've been through the last couple of years. One of the things that I think was most disappointing when we went out of school in 2020 were the kids talking about those normal experiences that they had, whether it be sports, theater, clubs. Last year, we tried to do the best we could to have some of those activities. And for some of the ones that didn't run, there were a lot of kids who were really upset that they weren't able to do those things. Even the ones who got to play and be part of the sort of remote play we did, it wasn't the same. I think the thing that has made kids most happy at the beginning of this year was it seemed like we were sort of getting back to normal with those experiences. And my real concern right now is if we move forward with something like this and we have a timetable that would happen over the next couple of weeks, I can't imagine what it's going to be like to tell kids you can't participate in something you've been involved in since shortly after Thanksgiving, or the kids who are right now auditioning for the 7 through 12 musical, to say to them, you can't participate. And believe me, I'm all for safety. I would like to see as many people as possible get vaccinated. Not that it matters, but my own kids are vaccinated. And I think, a lot of you have made great points. We are in a position where some of our community members don't believe that this is a real thing, that don't believe in the vaccination. And it's hard for me to believe that kids would be punished based on the views of their families. And if they can't get it on their own, they don't really have a choice. And as you said, I've been here a long time, and I've been a big advocate for kids having the ability to do the things they love, their hobbies, their passions. And that's really my biggest concern, taking those things away, whether it's something as small as a club, whether it's something which we might think is trivial, like some of those simple experiences we have, or something as big as a senior in high school finishing their basketball career. I would hate to see that happen to any of them.
Jesse, thank you.
Thank you.
Okay, I thought Bonnie was gonna put her hand up again, and I was gonna say, all right, so
Nope.
now we're going to the subcommittee reports, and I just want to give a little background for the public who's on here with us, who may not have been at that meeting. We had started in the beginning of December considering whether a vaccine mandate would be something to consider. I know Berkshire Hills was in the same position of working on it, and so we brought forward at our December 16th meeting, the policy subcommittee submitted a policy which would have required vaccinations if students were going to participate in after-school activities. And in that discussion, we realized we were missing a lot of specifics, and our timeline didn't seem to be realistic. And so coming up to a holiday season, we sent it back to the policy subcommittee for reconsideration. Some research was done on policies from other districts in the eastern side of the state, and the majority of the policy subcommittee, which consists of 5 people, 4 out of 5 were in favor of putting forward a revised version of a vaccine mandate for after-school activities, which is going to be brought forward tonight for consideration. One doesn't leave things on the table in a school committee unless we like to finish our business. So I think we're coming to this issue a little better educated than we might have been back on the 16th. I can't believe it's almost a month since we last met, and with the holidays and COVID. So that's my introduction, and Dennis Sears had sent out a vaccination policy proposal. And can you raise your hand, members of the committee, if you have actually read it prior to the meeting, so I know who's in the know about it? So I see Laura, Bonnie has. Jeff, did you get to read it?
I did.
Okay, good. And let's see.
Danelle, Carrie Ann.
Yeah, Danelle read it. I read it. Art's seen it. Okay, just want to make sure. With the short notice, it being just developed. I want to also say that we left it with our chair to come up with a revised policy that matched one that we saw from Somerville, Massachusetts. That seemed to be a good one. We have not, as the subcommittee, voted on it yet, but you got to see it, and I think that's all I need to say. Danelle's hand is up. Danelle, is your hand really up?
I think she was saying she read it, right?
Yeah, no, yeah, I read it. And yeah, sorry, I don't know why it's so hard for me to hit the button. I just want to start by saying thank you, Dennis, for taking the time to do this work. I did read it. I don't think it's anything that looks like we had discussed. I was hoping for something a little bit different, but I think reading the wording, and maybe this is in an effort to speed things along, read the wording and order of the way in which it's written. I strongly feel that I don't think we're in any position to try to pass this tonight. I think it will be a repeat of a lot of back and forth between questions from the committee, questions from us, trying to propose a different way of saying it, trying to add in, trying to subtract stuff. I just don't think it's ready to be voted on in this state. So I'm not sure where that goes from here, if people agree, but that's my opinion. Thank you.
Thank you, Danelle. I see Bonnie's hand.
I'd like to suggest that since it hasn't been put on the table, that I would make a motion, and I really appreciate so much what Danelle just said. I make a motion that this policy draft go back to the policy subcommittee, and it having attended part of your policy meeting, as Danelle said, this doesn't reflect discussion. I think it has to go back to policy.
Second. So I'm seconding the part of the motion that was
send it
needs
back
to go back to the policy subcommittee for polishing.
Is there any further discussion here on the motion?
Yes, I'd like to make a discussion, which is that I think there, basically there are 4 other districts in the Commonwealth that have something like this policy. That's what this was built upon. Okay, Cambridge and 3 others are the only ones in the Commonwealth that have done something like this. Okay, and I think that with the discussion we've had tonight, instead of saying, well, I think we at least as a school committee should be able to, with the discussion we've had, I think make our own opinion formed on whether or not we want to even do something like this, or whether we want to continue on with the good work that the administration has done, and to continue down the path of doing everything we can other than something like this.
Thank you, Dennis. So I think the way to handle this is if we vote on this motion.
Jeffrey's hands up.
Okay, you have something, a rebuttal? Go ahead.
Well, no, I just want to state, like, personally, I've had to reread it multiple times, and I'm still having a hard time wrapping my head around some of it. I find grammatical issues and syntax problems. Like I'm having a hard time following it. So even if we were trying to workshop it in this, like I would have a hard time voting for this or against it or whatnot. I think it needs to have multiple eyes on it, polished, deliberated in subcommittee, and then pushed back out for further discussion.
Bonnie?
I want to just totally second what my colleague Jeff said. It also, when you take it back to committee, this looks like it's aimed at addressing everything, including the bubonic plague. And I also read it multiple times, and I'm happy that, and not just because I wrote it, that we're able to, in the interim, carry forward with everything that Beth's doing based on the motion that the full school committee approved. So I totally support that we do not in any way try to workshop it here. And I think we've heard a number of comments from the public that should also inform any actions of the policy subcommittee. So I'm saying I support my motion.
All right, so I think let's vote on this motion, which is to send to request that whatever Jeff said it is. I hope-
It's to send the policy back to the policy subcommittee for a rewrite. Simple.
Okay, all right, so let's take, I'm gonna go around. Jeff,
Yes.
Danelle,
Yes.
James,
Yes.
Laura,
Yes.
Carrie Ann,
Yes.
Art,
Yes.
Kara's absent, Dennis,
He's muted.
No.
okay, Bonnie
Yes.
and Jane. Yes, now, I would like to, before we leave the policy subcommittee item here, I would like to I'd like to make a motion that the policy subcommittee also consider crafting a policy for us to consider about requiring pooled testing for after-school activities.
Second.
Okay, so any discussion on that?
Yes, I'm trying to get my hand up. Yes. I would hope that it would not just be after-school activities. That it considers all extracurricular. We have activities that take place other than right after school.
Oh, sure. We have to define, well-defined.
So, right, so I'm saying I'd like you to amend your motion that it considered pool testing for all extracurriculars as the policy committee defines it when they meet,
Okay,
with the help of the superintendent.
I accept that.
I accept your acceptance.
And Carrie, and now we're having discussion. Carrie Ann.
Thank you. So we all agree on the importance of pool testing. And so could somebody explain to me why it is that we can draft a policy and potentially implement a policy on pool testing in our extracurricular arenas, but we are not able to do this for our full academic school community arena? You know, we know the problems of the opt-in testing right now. So if we're going to be talking about drafting policies for pool testing just in our extracurricular, why can't we do it in a larger sense? Thank you.
Sandy or Beth, can you respond?
Well, I think it's an issue of supply and guidance again, right? So it is not advised that people who are already vaccinated participate in pool testing to keep it for, but it's very explicit in the guidance from the state that it's not our choice whether it's an opt-in or an opt-out. You have to opt in. It's not I can't say opt enough times. It's not optional.
Okay, I see.
So then why would it be optional for us to do it for extracurricular activities? Because doesn't the state
Because we're saying that those people we're talking about for people who are unvaccinated. That's the point, right? We're saying these people, it would be the same as an exemption. But we're not blanketing it across the entire district because what you'd be saying is everybody who's vaccinated too, right, would be in pool testing.
I don't know what we're saying. I just don't understand why.
No, but I thought that's what you were saying. If you were saying why can't we have to force everybody to do, or we'd be saying everybody opts in unless everybody's in unless whatever reason we're out. And that's not the system that we're currently able to operate under, supply wise and directive wise.
Julie wants to contribute.
I just think maybe I can explain this for Carrie Ann. I think I understand what you're asking, Carrie Ann. And so as I understand it, and anybody can tell me if I'm wrong, but what we're saying is that if you all made a policy that extracurricular kids needed to do pool testing to participate, their parents would still have to opt them in.
Yeah.
We couldn't, you know, it's still not an opt-in option. Like, we can say you need to participate in pool testing if you're going to do extracurricular, but the parents still have to fill out the consent form and opt in. It's still not an opt-out. Does that make sense?
So then, just to make sure that I'm understanding, so if we create a policy that says that extracurricular students have to be pool tested, and what happens if their parent doesn't opt them in? They don't get to participate in extracurricular activities?
That's the way I would understand it.
So it's the same framework as the vaccine mandate. It's just swapping in vaccine mandate for pool testing, but the structure is still the same. So we would still, like, in terms of the feedback of like, oh, we're then penalizing the kids who, you know, don't want to participate, or their parents don't want to participate, the same argument's going to get made.
I think they would
Yes, I
just
think
talk about
the
the
difference.
screen. Go ahead.
I was just going to say, I think the difference is that parents are more palatable to having their child test than to vaccinate them. If a parent is anxious about vaccination, we have a better chance of making it a palatable compromise that you would test, I think, is what the thought process is. Because if somebody is truly terrified of vaccination, it's going to be hard to convince them to vaccinate. Just like if you're terribly terrified of COVID, it's going to be hard to convince you that you shouldn't be vaccinated. You know what I'm saying? So it's a way to make people safe in a more palatable way.
I hear that. And as somebody on the policy subcommittee who's like, I mean, specifically now with this vaccine mandate, you know, we have gone through this for months trying to draft this and have run into so many different problems. And so, you know, like, we talk about how we're all at burnout level, like, this is again part of this burnout level of like, you're asking us to go back to the drawing board, like, to like, it's insane making on a variety of levels when we're splitting hairs about what, like, we're making these decisions of like, is pool testing, is the vaccine mandate, what is it gonna, that's palatable, as you're saying, Julie, to keep people safe, as opposed to just like us making a stand of what we believe is going to keep people safe. And it just seems like I just don't know where it's all going, and I just feel frustrated at this point. Thank you.
Point of order, the motion is James.
Yeah,
I'm just saying, we are discussing
yeah,
the motion to have a policy drafted by policy on pool testing.
yeah, I appreciate Carrie Ann's interest in knowing what kind of pushback that might cause before we invest a lot of time in crafting something that is going to get a negative result for kids, which is what a lot of us are worried about. So I think I personally feel like doing some research on the experience. I think the people that Sandy, Julie, and Beth have had some experience with how parents respond to pool testing, and how I know that there's been an effort to get more people involved in it. And Sandy, can you just comment on whether you think it would be, you have any sense of what we would come up against with this?
I think that we've already had some of the experience in that, you know, we've mandated that some of our staff members who were exempt from getting vaccinations, that they're participating in pool testing willingly. I think, you know, to Julie's point, I think it is just a little less intimidating, yet very effective. And I just don't, I think that there's the same feelings about it. It's a very simple process. It's something that many children, students and staff are doing on a weekly basis. You know, we're talking, 300 people are participating in this. It's kind of a typical thing now that's happening on Wednesday, that, the students know what to do. Also, just, to your point, Carrie Ann, regarding extracurriculars, it is a different setting too. In the school setting, we have a lot of mitigating strategies that are in place that we're all following every day. When you're talking about extracurriculars, not that they're not following them, they're just together in different ways, right? Like the wrestling team, you're going to be, pretty close. So I think there would be an understanding on the part of the parents that this might just be a way for their children, if they're choosing not to vaccinate, to continue to participate in a really non-threatening way. That would be my thought on it.
Dennis, you want to add to the discussion?
Yes, I do, because I feel now that I don't know anywhere near as much as what I thought I might know about pool testing. And a couple of questions that I'll raise and try to get some answers for is that who actually is now getting pool tested? Is it a combination of people, of students that have been vaccinated and ones that have not been vaccinated?
Yes.
Okay, that was kind of my assumption, that it was kind of more of a general thing that, was okay. It doesn't matter whether you've been vaccinated or not, and who determines who actually gets involved in the pool testing?
You have to opt in.
Oh, you do have to opt in.
There's a consent and you have to opt into it. And when you opt into testing, you're opting into all kinds of testing. It's one, right? It's one opt-in. So that means it's test and stay, it's pooled testing. When you say yes to testing, it's yes to testing, whatever mitigating testing option we have.
So how does this all arrive? Like at the start of the school year, do people get a chance to, well, I'm going to sign up for opting into pool testing?
Yeah, you can decide to join anytime. We're happy to have you.
Oh,
Unless
okay.
we tell you have to, which means like, if you haven't been vaccinated, you have an exemption. The school committee has stated that those staff members would have to participate in pool testing.
And Dennis, just so you have a picture of it, it's very user-friendly and simple. The people that are testing walk around with a cart to classrooms. Everybody's aware that it's coming. The teachers are aware of who in their classroom is a part of the pools. They gather up their kids, they come out, blow your nose, sanitize your hands, swirl, 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 put it in the tube, and now sanitize your hands again. Okay, thank you very much. It's a very simple, quick, non-threatening process.
Does anybody have a feel for like what percentage of the student population base is involved in it?
Just under 50% if you say 300.
Yeah.
Or right at 50%.
A little under, yeah, with the staff, because there's staff in that number too.
Yeah, but I think I'm also hearing that it would be easy to increase that 50% to maybe 70 or so, right? Easily?
Not necessarily.
Well, I don't know if that's easy, but we will make it happen if they want to be tested. That's how we look at it.
Bonnie?
My suggestion is that if we pass this motion, it will be up to the policy committee to go to the necessary resources like Sandy and nurses and Beth and craft the policy with the additional necessary information. Because Beth and Sandy gave us a whole profile of pool testing, and we've been getting it on an ongoing basis. So I think that would become incumbent upon the policy committee.
Carrie Ann, I'm going to go to Arthur because he doesn't have a hand to put up except his own. And so I don't know what order he put his hand up in. Okay,
Through all of this, I'm against pool testing. By the time we get this done, if we get it done, winter sports are going to be over. Everybody's so tired of trying to deal with this. I think it's very non-productive.
thank you, Arthur. Carrie Ann.
Thank you. 2 points or questions. One is that at some point in time, Beth, during one of the earlier in the meeting, there was talking about it sounded like that there were fewer tests that were actually available, and that we were reducing the numbers that we were putting into pool testing based on the amount of tests.
Yeah.
So I'm wondering if
Yeah.
so the first question, is that true?
Go ahead, Sandy. You can, it's
No,
not that
I
there's,
heard that wrong.
No, that's not true.
Okay, so we
do-
have access to as many tests as we need.
No.
no.
That's also not true.
Right, yeah. So
Okay,
sorry.
so if we're going to create a pool testing, are we staffed enough and have enough resources to test the students that we're talking about?
So our belief is yes, because I had a conversation with our program coordinator and she felt like she could manage it. I mean, we'd have to see the numbers, right? We don't know this. I'm assuming that many of our kids who participate in extracurriculars are already in pool testing. So, that's the question. I don't know what the additional numbers would be. We're talking about every extracurricular. How many kids is that? I don't know. So
Okay.
you have to look at that. But.
Thank you. And then the second part of the question is that there are parents, some could even be on here right now, who could feel like testing is an invasion of privacy for them. In the same way, they may have feelings that they are not interested in getting their children vaccinated. And so they can then come to us with the same exact arguments that parents are on this meeting right now saying that they feel like because their child will have to get pool tested, that they will be missing out, that their mental health will have problems. So it just seems like we're then deciding that it's okay that that if there's a smaller number of children who are having mental health problems, that it would be okay, because then we're creating a more palatable option. And I just don't understand where we're like, what these numbers are that we're deciding are okay for the mental health problems of our children. If that is the argument that people are bringing, they're still going to bring it potentially for pool testing. Thank you.
Jeff?
Thank you. Carrie Ann, I appreciate the points that you're bringing up. I think that there's several cleavages to do this. And Art, I'm going to disagree with your position. Yeah, maybe by the spring and the conditions change and whatnot. This is now the third academic year that we're dealing with COVID. We still have, this could come back next year. And the last thing I'd like to see is that we have an opportunity to craft a policy, even if it's rendered not usable in the spring and fall, but then when it comes to winter sports, we have a policy ready to go possibly for next year, if it's there. Now, to the point of vaccinations versus testing, and I think that people have different appetites on this committee and in our community as to whether they're acceptable, one's acceptable and one's not, both are not acceptable. I think doing the work with multiple policies allows us the opportunity to have a backup plan if something does not go forward on vote with vaccinations, if that's the case, because it's a little bit more contentious, that we have another possible backup with it. So I'm not saying that feeling like defeatist, but I'd hate us to not have something to move on if something fails in vote next time we meet. Thank you.
I'd just like to add one bit of information to this discussion, and then I'd like to have the vote. For those of you who are not aware of some of the research that was done about after school activities policies, Beth was able to get a Berkshire Hills policy and not that we need to copy one or another, but they've had some experience now because instead of a vaccine mandate, they went to a mandate for pool testing if you're going to be in extracurriculars. So they put that into effect maybe 2 weeks ago. And we certainly can get some feedback from them about how that was received, which will be helpful for the policy committee, I think, because we're not that dissimilar in communities. So without any, if there are no further need for discussion, I'd like to have a vote on this motion. I don't see any other hands up. So Jeffrey,
Yes.
Danil,
Yes.
Jim,
Yes.
Laura,
Yes.
Carrie Ann,
Yes.
Art,
No,
Dennis, Dennis,
Didn't unmute. Yes.
thank you, Dennis. Bonnie
Yes.
and Jane. Yes, so that, I have a new scoring system here now, so I can tell you the last motion passed 8-1 and this motion passed 8-1 because I feel like I have to keep better track of who's voting what. So thank you very much for a really fruitful discussion and for all the input that we got. I'm sure we're going to be getting more input as we go forward. We will be making every effort to get information out to the public ahead of meetings, but because our administrative assistant has been ill and our next meeting is a week away, it may be a little bit difficult to get materials out to people in a timely manner. And that might sound like an excuse, but it's just the reality. So let's go on with our agenda here, and we are going to hear from Bonnie briefly about how personnel and negotiations is coming along.
Thank you. Yes, negotiations subcommittee has been meeting. We actually met again today. We've received proposals from the SBREA. We countered those, and we will have our next negotiations meeting on the 27th. I'm not giving more details, just so the public knows, because we are not allowed to, as negotiations take place in executive session. And just a quick aside, there was nothing ever sent out for February 7th and March 8th, so I will ask for Lynette to send that out to the negotiation subcommittee.
And at this point, I want to thank the negotiation subcommittee that's putting in a lot of hours that and over a series of months, and already have many other meetings to attend. There's very important work that's going on now, because it's very hard to negotiate when everybody's a little bit on edge, as staff and administration are with our current situation. So thank you, Bonnie, for leading and for the work that's going on. And now Art is going to give a brief update with Beth's help about our situation with buildings and grounds, if Art's still here.
Yep.
Okay. Oh, there you are. Hi, Art.
There I am.
All right.
So building and grounds met. We've been discussing the ventilation system. It did go out to bid. We thought the bid was going to be around 1.5 million. The bid ended up coming in more like 2.7 was the lowest bidder. So we are We rejected the bids. We don't have that kind of money. We're looking at breaking, instead of doing the whole thing, breaking this out in sections to see how much of it we can get done with some of the money that we have available. And that's where we're at right at the moment.
So if I could add to that, that was an excellent summary. I would say that you know, we were very committed to A, getting the project done and moving. B, it shows you what the cost of steel is doing right now. So we should all be thinking a lot about building things from scratch. But I will say that there are some other opportunities, and we have not given up on the fact that we're definitely going to do it in phases, which means that the design is being redone right now, so we can act on that. The other piece of that is that there was I believe on December 13th or 16th, the governor signed a new grant opportunity for HVAC, which was $100 million. And I'd like to think that we would be a good candidate. Number one, because we've already committed to doing this. It's part of our Student Opportunities Act funding. Our communities are on board, and when you support it and you've put your own money in, a lot of times that lets the state know that you're serious, and they tend to help out with those types of projects. So we will be applying for that type of funding when it becomes available. We also have some other opportunities. We have some capital funding that we'd bring all of this in a formal plan to the committee, obviously. But we're going to look at what capital funds we have left, and this could be part of our capital plan moving forward. So rest assured, we're still working on the assumption that we're going to try to do this without going to the towns to borrow. So we'll keep everybody posted, but we're in the process of re-looking at that project, but still continuing to at least start it in the phases, because we're committed to doing that.
Jeff and then Bonnie.
Thank you for the update. Just a quick, more topical question about the boiler at New Marlboro Central. Yes, what's today? Thursday? That went out yesterday. What was the cause of it, and is this something that's going to be coming up in upcoming maintenance?
So I would defer to having Jeremy give that
Okay.
report, and I think he can do that at the next Buildings and Grounds or when we do the Finance Committee capital. But the point is, I don't think it's anything. It was a quick fix, let's say that, and we don't have to worry about, because we just did invest in that. So it needed a repair.
Yeah.
It needed, we need to do some things differently, like not keep the system balanced so that we don't put pressure on it, and that we don't need to. You know, sometimes we just have to keep windows closed in the right way, you know, just to keep everything balanced, and we should be good to go with that. So but we can ask more formal questions of him and when we have him in front of us.
Got it. And then for our next finance meeting, would this be something that comes in? Is it something that would be discussed at that point, or is it more?
It depends what information. Yeah, if we have information, I
Okay.
think we are going to talk about this in our capital plan for sure.
Okay,
And I don't know, are they on the docket for the 20th? It might be that it's capital and technology and capital for the first Finance Committee meeting.
Okay. Thank you.
Bonnie?
Thank you. Couple of questions. One, I think you answered one of them. You're trying to avoid going to the towns for a bond issue, but will that cost us more in the long run by breaking it up? That's part one of the question. Go ahead.
As far as we know, not yet, but that's why we have to get the design broken up to see what, you know, if that makes sense.
Okay, then because we are considered an, what do you call, emergency shelter area, are there any opportunities to go to the state jointly with our town to possibly access money from a different area.
I don't know the answer to that. I do know, though, that, I mean, to me, the big win would be to go for the 100 million that's specifically for HVAC.
Great. Yep, sounds great. I would just say it might worth a call
for
to see
sure.
if the town is aware of any other funds. And I'm assuming the MSBA has not expanded the areas for emergency repairs.
As far as I know, I haven't done one we're going on almost 5 years now. The last time I wrote one of them myself, but I believe it's still roof and windows, as opposed to are the ones that they're going for.
Yeah, roof boilers and windows. Can we have Jeremy just check to see if there's any?
I know that I get the
okay,
too.
you have the answer. Fine, thank you.
All right. I'm going to be really happy if we can say that we had a 2-hour meeting tonight. Is there anything else that needs to be discussed before I entertain a motion to adjourn?
Yes, I have one thing.
Yeah.
Beth, I really, and if, Charles is still here. I don't know if Jesse is. Yeah, he is. I'd really like to, and I don't know, I'm sure others, extend a major thank you to our staff for all they have been dealing with. I mean, not only their own personal lives, but from what I hear from kids, how many people on our staff have been so phenomenally supportive of our children in so many ways. So I hope you can extend, well, my thanks, but I think a good part of our staff's school committee's thanks.
All our thanks.
All of our thanks.
Would you like me to send a letter on the behalf of the school committee to the staff?
So moved.
That's fine.
Okay, do we need?
I just moved. Do we have a second?
Right. Second.
All right.
All right, so let's see, more work. Jeff.
In the
okay.
interim, Jesse and Charles, you've got the message.
Yeah, well, I don't think it would hurt if something came directly from us.
I think the
Okay.
gesture would be appreciated.
Okay, so Jeff,
Yes,
Danil,
I think she had a drop.
okay, Jim,
Yes.
Laura,
Yes.
Carrie Ann,
Yes.
Art,
Yes.
Dennis,
Yes.
Bonnie,
Yes.
okay, and yes from me. Okay, I'll get that done tomorrow.
Jane,
Yes,
motion to adjourn.
Second.
all right. That took a long time. All right. Jeff,
Yes.
Danil's gone. Jim,
Yes.
Laura,
Yes.
Carrie Ann,
Yes.
Art,
Yes.
Dennis,
Yes.
Bonnie,
Yes.
and Jane. Thank you for what I would call a lovely meeting. I thought it was one of our better ones where we all got to say what we needed to say, and I think some progress was made, but I'm an optimist, so I would always see it that way. Anyway, we'll see each other again next week, and policy committee will probably be hearing from Dennis about when to set up a meeting. So thank you very much.